So, joint pain is one of the most common reasons women stop taking their hormone therapy early. And if that's you, if you're stiff getting out of bed, aching in your hands and your feet and your knees, and you're wondering how you're going to take this medication for years, I want to tell you something really clearly. You're not imagining it, you're not being dramatic, and it's not you just getting older. There is a real documented mechanism behind this, and almost nobody explains it. So let me give it a go. I'm Melissa. I'm a certified integrative cancer coach. I'm a former litigation lawyer, and I've worked with over 600 women navigating treatment and recovery, including a lot of women on hormone therapy who were told that joint pain was just something to live with. Before anything else, nothing in this video is a reason to stop or change your medication. Hormone therapy is doing important work to lower your risk. You obviously should have a detailed conversation with your oncologist. What I'm giving you here is the why and the direction so you can have a better conversation and, importantly, support your body alongside the medication, because this is the bit that we don't get told. So here's what's actually happening. Aromatase inhibitors, drugs like letrozole, anastrozole, and exemestane, they work by lowering estrogen. You have lower estrogen than a normal woman in menopause. That's the point of them. And for estrogen sensitive cancers, it matters. Tamoxifen works differently by blocking estrogen at the receptor, but it can drive joint systems too. But here's the bit that nobody connects for you. Estrogen is not just a reproductive hormone. It plays a really important role in regulating inflammation. It keeps your joints lubricated and comfortable. So when you lower estrogen sharply, you're not only affecting the cancer pathway, you're changing the environment inside your joints. And the result has a name: aromatase inhibitor musculoskeletal syndrome. It's well recognized in the research, and it affects a large proportion of women on these medications. And we don't get a lot of support for it beyond take more drugs. So let me say the part out loud that you might be living and not telling anyone. It's the jar you can't open. It's the first few steps in the morning when your feet hit the floor and ankles don't want to take your weight. It's gripping the steering wheel or the stairs you dread, or you laying awake trying to get comfortable, or not being able to get down on the floor and play with your children or your grandchildren. That's real. It's not in your head, and it's not you being difficult. So why does almost nobody talk to you about this? Same reason as always. It's structural, not personal. Appointments are short. The drug is doing its job on the cancer, and okay, sure, that's the priority. Joint pain doesn't show up on a scan, so it kind of sits in the gap between what gets treated and what gets lived with. And many women report it, and many quietly decide to stop the medication because nobody offered them another option. And here's why that matters so much. Stopping early can affect the protection the medication is giving you. So a side effect nobody helped with quietly becomes a risk decision made out of sheer discomfort rather than out of a real plan. You should never be left in that position because you have options. And here's the part that matters most. There is another option. I'm going to tell you about it, and it sits in your terrain. Remember, estrogen change increased inflammation in your joints. Inflammation is one of the highest leverage things you can influence through how you live, not instead of your medication necessarily, alongside it. And the research on anti-inflammatory lifestyle support is really encouraging. Movement, even gentle movement, is one of the most consistently evidence-supported things for aromatase inhibitor joint pain. I know it feels backwards when you hurt, thinking, I don't want to move because it hurts. But actually, if you don't move, it hurts more. And the evidence is really strong. Also, what you eat shifts your inflammatory load. Sleep, body composition, and stress all feed into this same system. None of this is a magic fix, but together, you can change the terrain that the pain is living in and reduce it. There's a bonus in this too, because the same gentle movement that eases the joints also supports your bone density. which matters a lot on the aromatase inhibitor medications. One lever, more than one payoff. Reduce inflammation, move your body. That is how terrain work tends to go. When you shift the right thing, several problems move at once. Reducing inflammation, supporting hormone balance, protecting the body. Those are questions worth asking of anything that you do. So the reframe is this: anti-inflammatory living is not a nice extra for women on hormone therapy. It's a direct response to a known mechanism. And it's a lever that you actually have. You have control over a lot of this. One important caution, though, because this is where some women hurt themselves without realizing. Be very careful with supplements marketed for joint pain or for hormones. Some of these actually have estrogenic activity, and in a hormone-sensitive cancer, that's exactly what you don't want. This is not the place for guessing. Anything you take should be checked against your specific diagnosis and your medication. Protect the work that your treatment is doing. But this kind of mapping, taking your medication, your symptoms, your terrain, and turning it into a plan that's actually yours is the foundation of my program, Cancer to Confidence, where it's built around your specific situation with coaching that adjusts as things change. Get a plan, get a personal plan. And here is your advocacy step for your next appointment. Don't say, my joints hurt. Say it in a way your team can act on. Tell them the joint pain from my aromatase inhibitor is, say, 7 out of 10, and it's stopping me from opening jars, walking my dog, sleeping through the night. Name the number and name what it stops. Oncologists, medical professionals tend to respond to data, to metrics, not vague. You deserve to have it taken seriously, so phrase it in a way where they will take it seriously. Because the joint pain and the broken sleep kind of feed each other, I've put together a free kit that supports both. The Hormone Therapy Hot Flash and Sleep Recovery Kit. It's a practical starting point. I would hand you if we were sitting together. It's linked below and pinned in the comments. If this is just finally explaining something to you that you've been struggling with for months, I'd love to have you subscribe. I make videos for women who were handed a medication and very little else. The pain is real. So is the response that you have available to it. And I'm here to help you all the way.